Harnessing innovative financing options for nutrition, unraveling the bottlenecks is the theme of the visual conference put together by Aisha Buhari Foundation, International Society of Media in Public Health, CISLAC, and Network of Health Equity and Development. Nigeria's Vice President and Chairman of the National Council on Nutrition, Professor Yemi Osibanjo, said the country needs to look inward for funding for nutrition as resources from states and the federal government is not meeting up the demands due to increase in cases of malnutrition. Professor Yemi Osibanjo noted that the private sector must come in to support the 3.8 billion naira from states and federal government. The Vice President said the removal of the RUTF allocation in the revised budget is to fund COVID-19, noting that the executive proposes budget, but the National Assembly deliberate on what they think is of interest to them. He urged CSOs to intensify advocacy to the legislators.
Is to look more at what we can do at both the federal and state level, but more importantly, to direct funding to communities with the greatest need. I've heard of our civil society partners who say and who have said even today that we need to do more in terms of funding, federal funding and state funding, and also some have alluded to a sum of 800 million removed from the 2020 budget, and they said quite rightly that we should have this returned. I agree. But we must realize that the federal government proposes a budget, but the National Assembly may have a different view. And I think your advocacy before the National Assembly is crucial to drawing attention to what you consider priority.
The Vice President added that with the revitalization of primary health care, promotion of optimal breastfeeding, and the mandatory health insurance scheme, strategies to address severe acute malnutrition will be achieved. Nigeria's First Lady and founder Aisha Buhari Foundation, Aisha Buhari, said the foundation and other partners as part of the Consortium for Treatment and Prevention of Severe Acute Malnutrition will continue to reach out to government and stakeholders to invest in nutrition. Represented by the wife of the Vice President, Dalapo Osibanjo, Aisha Buhari hoped that at the end, stakeholders will strengthen their resolve to make and follow through with their commitments on nutrition. Chairman, Senate Committee on Health, Ibrahim Olorimbe, said it is unfortunate what is happening with the RUTF funds, noting that the removal of the 800 million naira fund by the executive is not the end, as there are still options that the National Assembly will use.
Because if you look at 2019 budget, it was only 300 million that was allocated. However, we were able to secure that 800 million to be in the budget. However, it's unfortunate because of COVID-19 and the review of the budget, that amount was removed in the proposal sent to us by the executive. It was stated from the budget office and finance that that's one part of the savings they are making from the health sector to be able to take care of COVID-19 intervention. However, I want to recall to that all options are not lost. I think the stakeholders of the sector, of the nutrition sector, will still lobby, particularly the executive, to get the funding for RUTF from service-wide growth.
Nigeria has an estimated 2 million children under 5 suffering from severe acute malnutrition, and only 2 out of 10 of them have access to treatment. 11,400 naira is the cost of treatment for each child with severe acute malnutrition. The question stakeholders are asking is what will become of these children since there is no budget for RUTF at the national level. This is coming when existing financing is not even adequate, which is why there is need for multi-sectorial financing. Elizabeth Carr, BATV News.